Kosciuszko County for the last several years has really expanded and grown, and I feel like our community has seen that the larger we get, the more options that we need for healthcare. We can be a home base. We can be the hometown hospital for a lot of our patients. Being able to provide our patients with expanded options for healthcare and keeping them close to home, I feel like is a big ticket item for our community members.
When we first started to consider what to build here in Warsaw, we started with an outpatient facility, and the focus was to build an emergency room and some outpatient services. It was quickly thereafter, after we opened that building, we realized it wasn't going to be enough. The volumes we had projected to be around year 5 is what we hit in year 1 of that building. Unfortunately, COVID hit us and we had to pause for a significant period of time. The good part of that was it really made us reconsider how the design of that building was going to look. So we refocused again after COVID and really came out with what I consider a much better design of the building. We're already hearing huge response from the community, from the open houses, the consideration that we've put into the flow of the building. It just feels like it was the right time for Parkview to grow in this market.
Bringing the Cancer Institute here to Kosciuszko County means a lot to me. Personally, having family members that I've had to travel back and forth from our hometown to Fort Wayne for their infusions, radiology, and all their other cancer treatments is really cumbersome and really taxing on the mind, body, and soul. So being able to have something here in our hometown and provide those services for those cancer patients is really meaningful.
What a facility really means like this to the patients of this community is being able to keep healthcare close to home. It means that they're able to have their loved ones come see them on a daily basis and not have to travel anywhere. The community has really wanted Parkview in this market. They've really wanted Parkview services, and we've seen them traveling long ways to be able to take advantage of Parkview. So we felt like the time was really right to put something in their market, in their community that they own that was part of their healthcare system.
Working in the community that I live in is very important to me because my patients are my neighbors, they're my friends, they're my family members. So Parkview Kosciuszko allows me to stay here in my community and provide services to all the people in my community that I care for.
I love my community. That's why I left the big hospital and came back. Taking care of your own is really an enriching feeling, and it's very humbling to be able to care for the people in your own community. So for me personally, being able to keep them here and being able to care for them while they're still here is a really big privilege.